We will call the July 23rd meeting of the Caroline County Board of Supervisors to order. Let the record show that all board members are present. Mr. Black representing Western Caroline, Mr. Seeley representing Bowling Green, Mr. Underwood representing Reedy Church, Mr. Akers representing Madison, Mr. Taylor representing Port Royal, and I'm Floyd Thomas representing Mattapan. This time we're going to ask Mr. Black to give us the invocation, followed by the Pledge of Allegiance.
Everyone please rise. Dear Lord, as we come here tonight for this meeting, we ask you to guide us, for all of us to make the decisions, all the supervisors to make the decisions, best decisions that they know in their hearts for the best interest of the county. In your name we pray. Amen.
Amen. Will you join me for the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All righty, thank you, ladies and gentlemen. Mr. Cully, you have an amendment, one you would like to make, and then at least one change. I'll go over. The amendment you want to add is
a continuation from last night's discussion on the $25 million bond referendum. We're going to give you some additional information on the cost of issuance on that, and whether you decide you want to amend that or not.
Okay. Excuse me. We're gonna try to do that as like 3A, which should be between the break. Give us a chance to take care of that. And we also have, I thought we had 2 closed sessions. One on.
No, we are.
Okay.
It was just worded as just one.
Okay. We had 2 closed meetings for legal advice. One referring to a water system and the other one referring to the Y. The Y one we can't do as closed session because there's no legal advice. So we're going to do that as just informational as item 7A. That'll be the first thing is new business. So 7A will be Y funding. I believe that's it, right, Mr. Cullen?
Yes, Mr. Chairman.
Okay. So we need a motion to add those changes?
So moved.
Okay, motion made by Mr. Taylor, seconded by Mr. Akers. All those in favor say aye.
Aye.
All opposed, nay. Motion carries unanimously. We will move to opening board comments. Mr. Black.
None at this time.
Mr. Seeley.
I have none, Mr. Chairman.
Mr. Underwood.
Mr. Chairman, just wanted to make note that I've scheduled 2 constituency meetings first week of August 5th at the Caroline County Tourism Center, and August the 8th at the Front Level Volunteer Department at 6 o'clock both days.
Okay, Mr. Cullen, you going to take care of the logistics for all that? Okay.
I think Pam already has, but
Yes.
we'll double check. I think it's already scheduled.
Yeah, she's outstanding. Okay,
I
that's
just
it.
requested that Mr. Cully and Mr. Whitey be at the second meeting. Thank you, Mr. Chairman.
Thank you, sir. Mr. Akers.
Not at this time.
Mr. Taylor.
Yeah, just a couple of, the Joint Land Use Study Committee is still meeting. We are supposed to have a meeting on August 1st. There is a pamphlet that's been put out. I don't know if you've had a chance to read it or not, but there were some concerns. I won't go into those, but I will say that if you get a chance to look at it, it would be good if you did, and certainly you can communicate any issues that you might have, certainly through Mike or myself, or I think Mr. Seeley is also kind of working with it through Bowling Green. So there are just some issues, and you might want to take a look at it and maybe respond to that. And the other thing I have is the Regional Local Emergency Preparedness Committee is a group. It basically deals with hazardous material and making sure that communities are in compliance as far as the law is concerned, should there be an emergency. You can't stop things, but you certainly want to make sure that you have done what you need to do. And the chief is meeting on Friday, as I understand it. This is sort of a regional approach, and so it's just something I think the board might want to be aware of. Again, I won't go into specifics, but you can certainly talk to the chief or myself if you want some further clarification on that. But I know that there is a meeting on Friday. So, but that's all I have to say.
All right, thank you, Mr. Taylor. I have just one, and it's just kind of a reminder that on this Saturday, the 27th, at 9 a.m., at the high school at latitude 38 degrees, we will have a groundbreaking for the Caroline Middle School students' 38th parallel project, tribute to the Korean War and Korean War veterans. The 27th of July is actually the 60th anniversary of the signing of the peace treaty for North and South Korea. These middle school students were smart enough to know that the 38th parallel went around the world and actually runs right through Caroline High School. So we're going to be there. Mr. Whiteman has done a great job with all of that. I want to give him a lot of credit. So he's going to be there, and we're going to celebrate with them and reflect and remember what went before us. So that takes care of it. At this time, we'll move to agenda item number 1, which will be presentations. We have two, one from Dr. Rossheim and the other from the Electoral Board. Dr. Rossheim, you listed as first. So good to have you again.
Thank you, Mr. Chairman. Thank you for having me. Mr. Chairman, members of the board, Mr. Cully, good to be here again. I wanted to go through in a little bit more detail, and I think maybe it explains things a little bit clearer, sort of what we would be looking for from the health department standpoint for the dental clinic. So basically, this is a slide from last time. I just put this up here just as a refresher to show the overall expenditure and revenue data for the Caroline Dental Program from fiscal 2010 through fiscal 2013. And you can see that in fiscal 2013, the same preliminary budget, the same preliminary loss of $41,488. That is not, none of these numbers have changed from last time. For FY13, that loss of $41,488 will be carried over to FY14. And for FY13-14, the county has appropriated $308,450 to the Caroline County Health Department, and that $41,488 will come out of those funds that the county has appropriated for FY14. So basically, those are expenses that we have already incurred that we need to pay off. These are numbers that this is a new table, and what I wanted to show in this table is the estimated expenditure and revenue data in terms of keeping the Caroline Dental Program open through September 30, 2013. So you can see in, as we talked last time, the summer is typically a slow time for the dental program because the kids are not in school, and so therefore the number of visits is much lower. But our expenditures are basically the same. You will see that in July, estimated total expenditures $26,610, estimated revenue $8,000 for a loss of $18,600. If you're wondering why the expenditures in July are greater than August and September, it's because there are 3 pay periods in the state in July. If you look at August 2013, you'll see, again, let me back up. This is based on historical data. We went back and looked at previous years to get these estimates. So if you look at August 2013, you're looking at a net loss of about $8,000. If you look at September of 13, an estimated loss of about $12,000. So total for keeping the clinic open for 3 months, the first 3 months of FY14, looking at about a $39,000 projected loss. As you know, we are working with Central Virginia Health Services to take over the dental program. And given the collaboration between us, I've received permission from the central office to keep the dental clinic open through September 30, 2013. So they've allowed that to basically happen. So the request would really be the following: that based on historical expenditure and revenue data, keeping the dental clinic open from July 1 through September 30 will incur a loss of about $39,000. And therefore, we would request that the board appropriate $39,000 to the dental program for those FY14 anticipated losses to keep the clinic open through September 30. And that's it. And I'm happy to take any questions that you all have.
I would imagine there are going to be a couple. The bottom line is you're saying that of the... You want to go back to a slide? Which slide you want to go back to before? Can you go back to slide 2, sir?
Yes.
That one? Okay. Go ahead, Mr. Underwood. Oh. Okay. Well, in that case, let's go back one more, or forward one more. Yeah, okay. So you're saying that Caroline County for this fiscal year, starting, well, we're saying, starting July 1 to June 30th, 2014, we have appropriated $308,000
Yes, sir.
to the health department.
Yes, sir. That's correct.
Okay. And as the state health department, your boss, because we've all got bosses, we've got 4,000 bosses each, but you report directly to the legislature? Or
I report to the Deputy Commissioner for Community Health Services. That's my supervisor.
Okay. But you're organizationally, then you report to the legislature, or the governor, or whoever, somebody like that.
The deputy reports to the Commissioner of Health, who is the leader.
Secretary of Health, okay.
Who is the leader of the Commissioner of Health.
Okay.
Is the head of our agency.
Okay. Now, someone in that management chain made the decision that of our $308,000 that we appropriated for this year, that they would take some of that money and pay last year's bills? That's not your decision, is it?
That's a decision that we made locally, but we have to pay that bill off. There's no other way to do that.
Okay, so the $308,000 that we identified for programs for this fiscal year will be short by the $41,000 you're going to take. So there's obviously some impact on other programs because of last year's shortfall?
Yes, that's possible, yes.
Have we given them all that money yet? We pay monthly, right?
Quarterly.
Quarterly? You got a quarter's payment so far?
Yeah, he's got the first quarter payment.
You haven't?
Yeah, you have.
We're not sure if we've received your first quarter payment yet.
Okay.
Yeah,
Did you send it yet?
I asked.
Okay.
You had told me earlier when we talked about this that it had been sent, because I'd asked you, have we sent the dental payment? You said, oh, yeah, that check's already gone. So I'm pretty sure they've had the first quarter.
So, okay. Dr. Rossheim, I mean, you kind of have to understand our perspective, or at least mine. I'm just speak for me.
Sure.
I sent you to the grocery store with $100 to buy this week's groceries, And you're basically saying because you didn't have enough money last week, you're only going to have $50 to buy my groceries this week.
Yes.
And that analogy doesn't sound fair at all.
I'm not, the dental clinic unfortunately hasn't brought in the amount of revenue that we would have liked to see it bring in, and that leads to a shortfall.
Have you identified what program will be impacted by the $41,000 you're going to take?
No, what we will do is we will have, depending upon what happens this evening, we will go back and look at what money we have, and then we will decide on what we need to do in order to, get mandated services done for the Caroline Health Department and, how we're going to manage that. So that will be our next step.
Okay, I'm not finished, but I'm going to share.
I guess, three comments.
Well, let me, go ahead.
First one was you said possibly that the 41,000 would come out of the 14 budget.
No, it will.
No, he said will come out.
It will.
The second one was, I want a definition of who we is that decided that you could roll this forward from last year to this year, because you said we locally.
We've talked.
Who's we?
We've talked that over. I've talked that over with my boss at the deputy commissioner level. You've talked it over with. I mean, we've talked it over with the central office. That the woman that I'm pointing to is Mary Pat Hoadley. She's our district administrator, so she handles all the finances. We've talked this situation over both with on more than one occasion with the central office, and they know where this stands. And there's no other way, because we either have to carry that loss forward against money from FY14, or we have to seek additional money to cover the loss.
A lot of money here in a minute. Go ahead and do your more.
I guess my last question is, if we had said, okay, we're closing the dental clinic and all you were getting is what we were sending, what would that have done?
If you mean closing the dental clinic?
When you sent us the letter, you said the dental clinic was closing like 1 July.
Yes.
If we said, okay, you're closing it, you're $41,000 in the hole,
right,
what would have happened then?
The same thing. We would have carried that loss over against FY14 money, but we wouldn't have the further losses going forward.
How did you cover the $57,000 from the year before and the $75,000 from the year before that? I mean, I guess I'm looking backwards going, if you keep rolling this forward, you're now over $200,000 in the hole, we're giving you $308.
One of the thing
We're not giving $308. We're not giving $308. That's not happening. You're not going to take my money that I'm giving you now and use it to pay the past bill. That's not happening. Can you go back to the slide, please, sir?
Yes. This slide?
Yes.
So the $75,000, you just kind of, the legislature just gave you more money?
No. What we've had at the health district is the health district has typically had a fairly high turnover rate in employees. So that has given us vacancy savings. We have used those vacancy savings. We've been fortunate enough to have enough vacancy savings to cover these losses. Okay? And so therefore we have not had to go back to any of the localities to say we are requesting additional money. What happened in FY13 is that our vacancy rate dropped dramatically. There was no way that we could know that ahead of time. So what we found ourselves in was that the situation where we had all these people on the payroll when typically we have a lot of vacancy savings. So we had we had very little in the way of vacancy savings, but yet we're still paying all the people on our payroll. So that crunches us from both ends. And see, that's why we're in the position we're in now. Previously, at Rappahannock, our if you look at our vacancy rate from VDH HR data, it typically runs in the teens, like 15, 16%. In FY13, it went down to about 3%. Well, what that did is that took away a huge amount of vacancy savings.
Right.
And what that does is that crunches us. That means we don't have that money available now.
And Dr. Ross, we can sympathize with your position. We as the county have done the same thing. We haven't hired certain people, and then we can roll that savings in or use that money to help us reduce our budget shortfall.
Yes.
But the reality is, I'm giving you $308,000 for mandated services that the Commonwealth says we have to support, right?
Yes.
Now, you're going to take some of that $308,000 and pay back the $41,000 from last year's loss, understand, but that also means that $41,000 worth of mandated services will not be performed.
That's possible, yes.
So I'm not going to get in trouble for the mandated services not being performed.
But one of the things that we would do is we would, go back and look to see, for instance, if by some chance, for instance, our vacancy rate went up, then we would be saving money. So the point is, depending on what happens here, we would go back and look to see, what is it that we need to do to make sure, because obviously we're going to make sure that the mandated services get covered. That's our mission. So that's where we have to do our work as well.
All right, I'm sure there are more questions, but go ahead.
Dr. Rossheim, thank you for coming. Just have a question about your total expenditures based on 2010, 11, 12, and then the preliminary.
Yes.
I noticed that you have a drop in expenditures of about almost $50,000 from 10 to 11.
Yes.
And you maintain that for a couple of years.
Yes.
And now you're up 40,000 in 13. I guess you're looking at the same amount of expenditure for 13-14 school year, for the 13-14 years. Is that correct?
Yeah. I mean, the total, the reason that you see that drop is because our dentist left in 2011. So there was a period of time in fiscal 2011 and in fiscal 2012 where we did not have a full-time Caroline dentist. And that's an expensive position. And so that's why you see that number. The cost of running the dental program is about $240,000 to $250,000. If you look at FY10, we had a full-time dentist, during that time. So that's why you see that drop, and that's why you see it come back up in FY13, is because we had a full-time dentist back on board.
But then we've appropriated $308,000 for this year. So actually, you would, if your cost of operation is $240,000, then actually you're still saving about $60,000 based on your projected expense for 13-14. Is that correct?
No, sir. The 308 is our total health department. We give 30-something for the dental clinic.
Okay.
So the dental clinic itself expenditures he's showing you there, a majority of that's coming in from reimbursement from Medicaid.
Gotcha. Thank you. Thank you for clarification, Ms. Carter.
I do. Mr. Rossheim. All programs that are provided by the health department, do you price them out such as you have the dental program?
We have, we have budgets for them, yeah. Yeah.
And you often go over or under on those particular programs? Because I know that it's just not the dental program that's administered through the health department. I mean,
right.
I'm sure they pay for the septic tank permits and all of those drain
Right.
fields and those type of things. So my question is, why is it that we have been able to price out the dental program as you've shown here and say that's going to be such a portion of the total amount we give you versus not those other programs that you provide through the health department?
Well, I think one reason that dental lends itself to that is because, we know what we pay as far as employees and for materials and for other things. And we also know what we bill, we know what we're going to get reimbursed from Medicaid for the services we provide. With other services that we provide, like on-site sewage, septic, the costs that we they're not as neat in terms, because, for instance, it's hard to tell exactly, down to the kind of minute how much time one of our on-site people is at a particular, on-site issue, that sort of thing. Again, if we deal with an outbreak, there may be many people who are involved in the outbreak, and we do capture their time. We have a time and effort reporting system, but with dental, it's much cleaner in the sense that we bill for a certain thing, and we know down to the penny what we will get paid back.
The septic, the wastewater, the sewer system, you get paid for performing checks, testing.
We get for issuing permits and that sort of thing, yes. But that doesn't. The thing is that doesn't cover the true cost of what it's costing the health department to provide the service.
I'm trying to get my arms around how we are able to pull out one program just because you're getting ready to eliminate the program and say that we are $41,000 over on that program. You may have been, as far as Caroline County is concerned, and I don't know, but it could be that you may be under $20,000 in another program. So would that not help offset some of that 41 that you're over on the dental program? The other issue that I have, and you talked about the turnover rate,
yes,
and how you're able to save money there. That is a agency-wide issue as far as turnover within the regional health department. It does not just apply to Caroline County, it applies regional-wide.
It applies to the health district, but it also applies to Caroline County as well.
How much were you over in some of the other counties that had a dental program?
Well, the biggest overage was in Stafford County, where we were over by where we were taking a loss of over $200,000.
Finish? Wayne, you finished? That's it. Okay. On that note, before I go to Mr. Taylor, that $200,000 you were over in Stafford.
Yes, sir.
You're going to take whatever Stafford's appropriation is this year and take that $200,000 back?
We're going to have to cover. Yeah, we're going to have to cover that loss.
Okay, Mr. Taylor.
Okay, yes. And again, thank you, Doctor, for being here. When we came together at our last meeting or a couple of meetings ago, we talked about keeping the clinic open. And if I'm not mistaken, we agreed to appropriate $30,000 to do that.
Right.
I guess my question is, does that $30,000 that we agreed to appropriate, can that not be used to address that $41,000? Or
yes, it can. And what it will do is, if you were to appropriate $30,000, that it will take that number down to $11,488.
Okay, so then you don't need $39,000.
We'd be happy to take anything that the board is willing to appropriate.
Well, I guess I'm confused because, we agreed to come up with $30,000, and we were told that that's what it would take to get this program through to September.
Well, again, that wasn't data that was not data that I provided you. That was data that someone else provided you. And that data, that was inaccurate. That's inaccurate data.
We had a presentation from some participants in the dental program, and I think the dentist or an assistant or something like that, and that's where we got the $30,000 number.
I understand, and that data was only looking at FY13 and not anywhere forward.
Okay.
And that data is also inaccurate data.
Okay. Well. So we're talking $41,000 as opposed to the $30,000 that we assumed. All right. Be that as it may, that's $11,000. Why is there a need to take Now, that $30,000 plus another $41,000 from the $308,000 that's been appropriated. You understand?
Can I answer that? I mean, we haven't agreed, we agreed in principle to give him the 30,000, but at the last meeting, we really didn't give it to him. So he hasn't factored that 30 in yet. So he's asking you for 39. If you were at 30, then you're 9,000 different from what he's asking right today.
So you're not counting.
So he's never been given that 30,000.
Okay.
Yeah.
Which he just said was inaccurate number, so you want more than 30,000, so we're not even consider that.
That's right. The number, the idea that, I think the idea that $30,000 would keep us open through the end of September 13 is not correct.
Right. Okay.
See,
But
and the
41,000
issue,
will.
Well, he needs 41,000
Plus the 30.
plus the 30,000
Right, that's
that
what
we
the-
have already in the budget. Of that 308,000, you don't have to know that. I think he knows this. Of that 308,000 that we're appropriating for the health department,
right,
30,000 or so is for specifically the dental clinic, right?
Yes.
Mr. Cully? Okay. Now, that doesn't cover
the 41.
his $41,000 loss for just this year. Or for just last year, I'm saying.
For
For just last year, because
FY13.
it was June 30th. So you already want 41,000 for last year.
Well, that's
Okay.
that's our loss for FY13.
Yeah, well, we're going to talk about that some more, but you already want 41,000 from last year, plus the 30,000 that's in the budget.
Correct.
That's the correct number that you'd be, I guess your budget would be made whole.
plus 9,000. So 41 plus 39.
41 and 39, okay.
Yes, sir.
So you want $80,000.
Yes, sir.
Okay, this is my position.
But that's only through September now.
For the dental clinic, right?
Yes, it only gets him to September.
Yeah, and I'm not doing it.
But it's going to be taken over after September.
It could close right now. If it closed right now, we're going to take that $30,000 that we're giving you
Yes.
in this year's budget
Yes.
and apply that to your 41 if that's the way math has to work.
That would be much appreciated because that would help defer the losses we've already incurred.
So that, I mean, our options are give you $80,000 right now, give you an additional, it's actually 50, 41 plus the 9 to make up 39, right? It's actually 50,000. We actually have to give you $50,000 additional funding now to make you whole. Cover the 41
Yes.
plus the program is 39 and we're giving you 30. So 41 and 9, you would need $50,000 to be made whole. Right? Yeah, that's what I'm saying, because he's got 30. You need 50. But the reality is, if we just pull out of the program right now, we're not giving them that 30. And then there's the 41 that's still an issue. Now, I think I know the other 5 of these guys. It's going to be a real hard sell getting that $41,000.
Well, I think one of the reasons that I presented this presentation was really just to focus on FY14, just to try to make this as the current fiscal year.
But I can't focus on FY14 if you got a $41,000 bill you're going to take my money from for 14. So you know what's going to happen. I'm going to appropriate money based on the bills you send me. You're not going to get that $41,000. There's no way I can give you that $41,000 because I already budgeted $308,000 for the specific mandated services that none of us mandated, the Commonwealth mandated, and you're the administrator for those. So if I give you $308,000 and you cut a mandated program or you don't perform the services of a mandated program, it's not our responsibility, it's the Department of Health's responsibility. So now you want me to give you all that $308,000, you cut that $41,000 out, you make the decision of what program doesn't get taken care of, and we get the responsibility of the phone calls for it? I don't see the sense of fairness there. And like I said, I understand your position. You've got a budget shortfall. Somebody's told you to make that budget shortfall up. But basically the people that you work for, the health folks, I'm sure some of this is other money. I can't see us coming to agreement to give you $41,000 to make up last year's shortfall.
I have one more question.
You know where the 41,000 is?
No, I don't have any idea where the 41,000, but I have a question as to why you're asking for it. My question is, what would have happened? What would have happened had the board said, you wrote us back in June, I think it was, and said we're going to close the dental clinic in July, end of July.
Then we would be saving money
No.
because we would not be incurring the losses of keeping the.
And they would have had our $30,000 in the budget already.
No, that 30,000 was only appropriated just in sometime in June, end of June or the first.
For that, yeah.
But my question has to do with, would you have then just said, hey, I'm $41,000, you're $41,000 in last year. It has nothing to do with starting July 1st. Okay?
Right.
Would have then said, hey, I'm not going to say anything to Caroline County Board of Supervisors or Caroline County Administration. I'm going to take $41,000 out, and it's all going to be fine.
Well, one of the things that we have done is, when that's why we met with Mr. Cully. We wanted everybody to see where we were financially.
So you met with him prior to the meetings we've been.
They met
having
between our last meeting
Yeah.
and today.
Okay.
And-
But prior to
and-
that, I'm saying effective. You sent us the letters in June saying July 1, it's cutting it off. We're not going to provide it anymore. And you're saying that you would have still notified him. You wouldn't have just gone ahead and taken the $41,000 out and said nothing to anyone about the fact is I'm using $41,000 of next year's appropriation for last year's expenses.
I mean,
Is that legal?
I mean, we notified I notified my supervisors in Richmond about, what the situation is. And that's why we went to meet with Mr. Cully we want to be transparent and show people what our books are, and that, we would have taken direction from Richmond at that point, that if we needed to take that money from the FY14 allocation, that's what we, if that's what we had got.
What would have happened, what will happen next year? Let's go forward to the next year. The dental program is not yours. And so what would happen if, let's say, for instance, in one of the programs that you provide, you run over? And I don't know how you define that and calculate those numbers. But suppose you run in another area. Will you then next year deduct what you have an overage for in another program, not the dental program, against next year's appropriation?
Well, we don't like to do that.
I didn't ask that. I asked you, is that what you would do or not?
That's a little hard to say.
Okay.
I mean,
I think we have turned this dental program into something that is not the normal and not the norm for the way the health department operates. What I would suggest, Mr. Chairman, if you would, is that you, if being chairman, and if the doctor would agree, is to meet with the people in Richmond that have helped him make that decision as to why and how we can work with it. It doesn't make sense.
Yeah, I offered that at our last meeting, but you had met with Mr. Cully, I think, the day after our meeting. I'm willing to do that. I'm willing to go with you to Richmond to meet whoever. But I can tell you my attitude is I'm only going to pay the bills that you send me. I'm not giving you any money ahead of time. You send me a bill and I'll pay it. But I'm not giving you any money ahead of time. Because if I give you money based on the mandated programs that the Commonwealth says I should have, and you take it out and use it for something else, it looks like I didn't do what I was supposed to do. So we're going to work on a billing and payment process with the health department. You send us a bill, we'll pay it. But we're not giving you any more money other than the money we already gave you. And if you didn't get it, you won't get it. But if we already gave it to you, you can work with that, but we're not giving you anything to make up the $41,000 that Richmond should make up. You can't expect the people of Caroline to make up for the Commonwealth shortfall. Again, we just don't do that. And again, we're in a position where we have to do services. I'm willing to pay for those services. That's what we do. But I'm not going to pay for last year's shortfall, because if we did it like this, I'm sure you'd get a bill from the federal government that said, oh, we lost X billion dollars, so now Virginia's share is this. That doesn't happen, does it?
No.
Right. So if the federal government doesn't do it to you, why should you do it to the local government? And it may not be you, but you're representing the Commonwealth, so I have to say you. Okay? So I'm willing to meet with you. We want to keep this program going. We're basically going to move on with the new people taking the program over, and we're going to work out our funding mechanism with the Department of Health. Okay? But don't look for any money from Caroline until you send us a bill. All right? Thank you again for coming. You have a nice day.
Okay. Thank you.
Thank you, sir.
All right. Because I got to spend money on my next guest, and I already got your voting machines from the last grant. So come on, Mrs. Moen, and we'll talk about the new electronic voting machines we should buy. How are you folks today?
Good, and yourself?
Oh, I'm doing great.
I have a short statement, and then we'll answer questions. Back in 2010, the state legislature mandated that we go away from our win vote machines that we've been using for several years. During last budget year, we purchased, using HAVA money, a DS200 optical scan machine. As we've gone through this process, we've attended several demonstrations on essentially 3 different vendors that are certified in Virginia to supply the optical scan machines. Print-Elect, ESO, and Dominion Voting. We realize this is an unfunded mandate from the state. None of us like that.
How appropriate. Okay.
We don't like it either. And believe me, I think all of our hearts were for the win vote machines. We were happy with them. They were working well for our county, and we saw no need to change. At the last legislature, there was another lobby to have the state legislature change their mind and allow us to continue to use the win vote machines, and essentially they said no and don't ask again. That decision was final. So we moved forward and looked at different brands, and what we've come up with, and I think you have a copy of the proposal. Where we got a big break on this one is Dominion Voting was in the last stages of getting their equipment certified, the ADA compliant portion of their machines. Because of that, they were willing, we let them set up in one of the polling places during the primary election. Because of that, they gave us a $10,000 discount, which I think was pretty good. And we also got to, we put the DS200 that we have out in the field, and we put the Dominion voting machine out in the field, and we put them both in precincts or in voting stations that had 2 precincts voting at the same place. The nice thing about going with the optical scan, one machine can vote 2 precincts, as opposed to the number of machines with the win vote that we have now. I think a couple years ago, maybe the electoral board, it was before my time, had given an estimate of about $120,000 to make the switch over. Mm-hmm. We've been working hard on this. We've really gotten the price down. With the we purchased in this last budget year new poll books, but it was a 50-50 grant on those. So in essence, we've saved about $15,000 out of last year's budget for reimbursement for grants. And just a kind of a footnote, Caroline has been one of the first in the state to utilize the online training for poll officials, which is, I think, going to be a great asset for us. It's free. It doesn't cost anything.